I'm Steve Adubato for JFK TV. You'll see activity, work going on, the expansion here at the ED, but we are pleased to be joined by Dr. Martin Gizzi, who is chairman of the New Jersey Neuroscience Institute at JFK Medical Center. Good to see you, doctor.
Thank you very much.
You know, we got a lot of expansion going on here, and it's going on all over JFK, and we're here to talk about the stroke side of things. But first of all, what does this expansion mean?
Well, one of the most important things about stroke care is the ability to process a patient quickly, get CAT scans done, laboratory studies done, examinations, and we will have dedicated bays for stroke in the emergency room that will make our process even more efficient.
That whole expression, Dr. Gizzi, time is brain, break that down for us.
Time is brain because every minute you have started to experience a stroke and have not reversed the obstruction of blood flow, you are losing vital brain function. So if we can get a patient in and reverse everything within an hour, the outcome will be far better than if it took us 2 hours or 3 hours. So the importance there is not only that we get our job done as quickly as possible, but that the patient get here as quickly as possible.
You know, it's interesting. We talk about time as brain. That's an expression, and you live by it. But in many ways, JFK stands out across the state, across the nation, when it comes to dealing with stroke and treating stroke victims. Why is it? Why is that you stand out in the field the way you do?
Well, we've been at this for a very long time, and we've been doing acute interventions for stroke.
What does that mean, acute interventions?
What we want to do is reverse an obstruction. A stroke is a blockage of blood flow to the brain, and we want to get that blood flow restored as quickly as possible. So giving TPA, which is a clot-busting drug, is one way of reversing that obstruction. Another way is to actually go in with a catheter and pull out the blood clot. And I think we're very good at getting that done quickly, but I think what really makes JFK the best in this regard is the continuum of care that we have. We have the Rehabilitation Institute right here under this same roof, which allows us to coordinate that care even before the patient is transferred over.
Well, that whole continuum of care, we actually hear that expression, continuum of care, a lot. Walk us through this. A patient, Mr. Jones, comes in. Unfortunately, he's experiencing symptoms of a stroke. Take us through, Dr. Gizzi, this whole continuum of care for Mr. Jones.
In a hospital, it's possible to compartmentalize care in an unproductive way. You could say, well, I'm going to devote the first few days to making sure that the stroke is reversed as possible, and then after a few days, I'll implement the rehabilitative care. But what we do is make sure that from the first day the patient comes in, that they're getting physical therapy, occupational therapy, speech therapy.
First day?
First day, absolutely. The moment they come up from the emergency room, we want them evaluated by the physical therapist. And the reason for that is reducing the chances of developing a pneumonia, a urinary tract infection, or a blood clot in the calves are very important to the ultimate outcome.
So that whole continuum of care matters a lot. The other thing is, in one of our other segments on JFK TV, we talked to the interventional radiology folks, and there's a whole stroke issue there, right?
Yes, absolutely. Our ability to reverse the stroke depends on a whole array of tools to open up blood vessels, restore normal blood flow to the brain.
Finally, Dr. Gizzi, you've been at this for how many years professionally?
Been here for 20 years, doing it for about 23 years all told.
Other than the expansion, other than the developments, the improvements going on here at JFK, what are you most excited about as a professional, as a clinician in the field?
Well, I think that the whole system of stroke care has come together in a remarkable way in New Jersey and across the country, so that we are now integrated with emergency medical services. They know about stroke in a way that they didn't know before. They can do evaluations in the field and phone in or radio in what's going on with the patient before they get here. So our team is ready to take action the moment the patient hits the door.
Thank you, doctor.
Thank you very much.